Hello everyone, Juxtaposition here. I'm going to do a short video on our healthcare payer-payee system because, healthcare is a concern. I've said in previous videos that Medicare is the dominant influencer of our healthcare delivery system, not your doctor, not your nurse, not the sweet lady down the block that's a registered nurse. She's not running the show. In fact, she's part of the show. It's a sad thing. I know a lot of nurses, and some of them have quit, and I respect them. And then most of them have not, and I don't respect them. I have contempt for them. I wouldn't trust them under any circumstances at all. They're bought and paid for, just like the doctors who work at acute care hospitals that have what's called privileges. Anyway, you have a system that's incredibly dysfunctional, and what could possibly go wrong with a dysfunctional system, right? Now, let's just take a simple example of, let's say you wanted to purchase an automobile and you went to a used car lot. Now, that's dangerous amongst itself because, you could be buying a lemon and the salesman might, God forbid, lie to you. And the odometer could be turned back. I mean, there's all kinds of shenanigans that go off when you buy a new or used car. You have a warranty when you get a new car, so this may be slightly less dangerous to buy a new car, but they're so ridiculously expensive, and there's surveillance tracking devices on all the new cars. So I would prefer to own, an older car. Okay, that has more mechanical and less electronic components. Anyway, when you go to a car dealership to purchase an automobile, you're the one who's going to pay for the car. You're the one who's going to drive the car. You're the one that's going to use the car. You're the one that's going to have to live with the car. And so you're generally going to be more involved in the transaction because you're the recipient of the benefit of the car and you're paying for it. Okay? That's the complete reverse of how our healthcare system works, right? In the healthcare system, we have what's called the patient. Everything emanates from a person who is sick or, let's say, has broken their leg in a bicycle accident or some kind of an accident where they fell down the stairs and they broke their ankle, or they broke their collarbone and it needs to be surgically repaired because it's so seriously out of whack. May need metal parts installed. So if you need intervention, healthcare intervention, because you're sick or because you have broken bones or you had a concussion, you would seek out a physician, right? A medical doctor. And that person is going to be associated with a medical group. There's really no sole practitioner doctors anymore. No Marcus Welby, MD, exists in our system today. So you're going to have to go to a medical group, find a medical doctor who's going to become your primary care doctor. Then he may need to partner with a subspecialist, like a bone surgeon, aka orthopedic surgeon, right? Or if you have a prostate problem, a urologist or a surgical person that deals with prostate, or you have a heart issue where you need stents installed, then you can use a cardiovascular surgeon. He's not going to be the primary care. He's just coming in to install some plumbing equipment from the lab where he is the pharmaceutical department corporation that signed him to a 10-year contract to only sell their stents. Not necessarily the best stent, the stent that he gets paid on. That's the one. Or the chemotherapy, to buy the chemotherapy for your cancer. Guess what? Those doctors sign a contract, exclusive chemotherapy contract, which means there may be a dozen different chemotherapy poisons out there to detox your cancer, but you're not going to get the choices. You're only going to get the chemo that your oncologist has signed a contract with. That's conflict of interest. It's not disclosed. They don't tell the patient that. They don't tell you that they're a one-trick pony show. It's like your mutual fund salesman or your friendly financial advisor. He has access to hundreds of choices, but he's only going to give you the few that he gets a vacation bonus kickback on or gets an extra endorsement fee, sales endorsement incentive fee. They have a number of different incentives if you use this fund versus that fund, or if you meet quotas. It's not going to tell you that. It's not going to tell you that, but that's how Wall Street works. That's how the car business works. It's how the motorcycle business works. It's how all sales businesses work. Why would you be surprised that the medical profession would be a different model than the motorcycle or car business? It's the same general model, but the payment system is completely different, because when you're the patient, you're the person who's seeking treatment. But you're generally going to be covered by insurance. That's going to be Medicare, or if you're an indigent, poor person, it's going to be Medicaid and the county of which you're residing, or where the accident happened, the indigent program of the county, and the state, the provisional state that you think you live in. Or if you're a younger person listening to my video, it's going to be your private insurance that your employer, your group health insurance that you get as part of your benefits for having a good job. You get benefits, right? But that's only 30% of all the medical doctor treatments are being paid out of private medical care. Most of it's coming from the older people. They're the ones getting the chemotherapy and the stent installations that are probably unnecessary treatments, in my personal opinion. Since I sat on an infectious control committee, most of our infections in the hospital came from unnecessary surgeries, like, installing 5 stents at one time. That's kind of excessive, in my opinion. That happened a lot. You get paid a lot of money when you have a person's rib cage open, so you might as well install as many as possible. It's a per stent reimbursement program. So the more the merrier, because that's how you get paid, right? Anyway, doctors are paid on a coding reimbursement system, not dissimilar than how the hospitals, the acute care hospitals that hire the nurses and have the expensive radiology equipment, the magnetic resonance imaging, MRI, or the computerized tomography, CT scanning, or the pathology that's performed in the lab, the hospital laboratory, where you can get your results quicker because it's located where your patient is in a bed, in an acute care routine bed, or a critical care bed, or an ICU intensive care bed. And everything's nice and close by. Radiology, the laboratory, pathology, confirmation of your diagnosis, the surgical suite, the morphine that you'll need when you get cut on. You need morphine. It's all there. So through Medicare and the payment reimbursement scheme involving private care health insurance, they've aligned the hospital with the doctor. They've done it 2 ways. One is that they make the reimbursement codes congruent, in other words, similar. And 2 is they form a partnership with the lab. The pathologist, who's usually the director of the laboratory at the hospital, he has to sign off and agree on the diagnosis reimbursement coding for the attending care physician, the primary care physician with his subspecialist. So the pathologist partners up with the doctors indirectly through representing the hospital laboratory pathology. So the 2 doctors galvanize the relationship between the attending care physician and the acute care hospital. They get paid the same way, and they all agree that the diagnosis and payment should be this, which usually is going to be, as high as possible. It's called maximizing reimbursement. Now, the patient is not, a party to this. The patient who's seeking treatment, you're not involved in a financial partnership between the doctor and the pathologist and the acute care hospital. You're just the test dummy who's going to have a stent installed or receive the chemotherapy either on an inpatient basis or eventually on an outpatient basis, and or they'll give you the chemotherapy, bags to do at home. They're even doing that now. That's super outpatient. You don't even have to go to the hospital. All right. Then there's the person who's paying the bill. That's the insurance company, which I'm telling you right now, that's 2/3 of that bill is paid by Medicare. And about 1/3 is paid by private insurance, like Aetna, Blue Cross, Blue Shield, something like that. The insurance company is not a participant in any of these shenanigans. They just write a check. They personally don't sit down with the patient whose insurance it is. They don't have a visit with him. They don't meet with all the doctors. However, they do have some internal controls over this system because they have access on the database to your social security number. So they know all the financial information on their policyholder, whether it's group or whether it's Medicare. You see how dangerous this is, people, when you're on Social Security, or if you're employed and they offer you benefits? In that database is your salary, your age, your sex, and pre-existing conditions, because they have access to your medical records because they're in the system of healthcare. And there is sharing of information that's going on without your knowledge, right? See, so I don't know if that affects the treatment that is eventually recommended for you. I suspect that it does affect it. So like if you're a dirtbag, if you're an indigent person, homeless, right? Do you think that they're going to do a liver transplant for you? No way. No way. So if you're not part of the system, if you're not paying in the system, you're probably going to get a lower level of care, meaning no care. I mean, there's a conflict of interest within the system, which is financially engineered to kick to the curb the homeless people. Now, what about the people that are on Medicare that are fully covered? Well, there's a financial engineering system to deal with you too. And unfortunately, that might be to prescribe treatments that you don't need, right? You may not need the treatment, but your doctor is going to recommend it because he's going to get paid. Now, how is that different than the car dealer that wants you to buy the true coat, which your car comes with a layer of clear coat over the paint, and then they want to put another layer on top of the layer that you already have, and then they want to buy extended warranty even though you already have a warranty, and then they want to buy you an extended warranty, and then they want to sell you the floor mats even though the car really should come with floor mats. Hey, do I get wheels and tires with my car purchase? That's what I always ask the salesman. Are the wheels and tires extra or is it standard? Because we live in maritime law, where it's your choices are Coke or Pepsi, aisle or window, smoking or non-smoking, vax, no vax, face diaper, no face diaper, right? So wheels, no wheels, I don't know. All right, so we have a system with healthcare where the patient is the person who's sick and is seeking treatment. They're the ones that are going to receive the treatment. But nowhere within the partnership of the primary care doctor, the subspecialty physician, the hospital, the nurses, the pathologist, the ancillary services of the hospital, or the payer being the insurance provider like Medicare, Medicaid, which is Medicare, or Blue Cross, Blue Shield, Aetna. Nowhere within that group, none of those people are receiving the treatment, and none of them are guaranteeing results of your treatment. So if you don't recover from your illness, don't go complaining to Aetna or Blue Cross or Blue Shield or Medicare. Go pound sand. Like, hey, I don't know anything about it. I'm not a doctor, right? And then when you go to your doctor, you say, hey, I'm practicing medicine. I'm not performing medicine. I'm practicing. And hey, it's complicated and things go wrong. How often does that happen? Happens a lot. And the hospital says, oh, hey, we're just providing a building and some beds. And I don't know, we're not doctors, right? So everybody's hiding behind the other person. So the doctors are separated from the hospital, which is separated from the insurance payer, who are all separated from the actual customer, which we call a patient. The customer is the patient. And we have nothing but contempt for the patient. The patient is a test dummy to justify a doctor getting paid, a hospital getting paid, and the insurance company engineering the treatment based on what those reimbursement codings might be. Now that's financial engineering in a nutshell. That's completely the opposite of if you wanted to go down to Home Depot and purchase some, hardware item. It's your decision to select which product off the shelf. You're the customer. You're in charge. We used to say when I was coming up that the customer was the most important person, that the customer is always right. Well, in healthcare, the customer is never right. They're always ignored. They're ignored. The customer doesn't pick the treatment. The primary care doctor does. That's messed up. If you've ever been arrested, arraigned, and had to hire a defense lawyer, a criminal defense lawyer, they think they own the bus. They're driving the bus. They own the bus. You're going to do what they say, which means you're going to plead guilty to a plea agreement. That's what that means. Which means they don't have to do their job because they're working for the district attorney. The district attorney, you'd get a better, if you didn't have a lawyer and you just went directly to the assistant district attorney, I think you'd get a better deal than if you wasted your time with the defense lawyer. Because the defense lawyer is going to do exactly what the DA wants. It's just they're going to pretend that they, worked really hard to get you a good deal. Poppycock. They go home early. They go play golf. Anyway, so I wanted to let you know that that's our healthcare system. It couldn't be more rigged for failure. The chances that you would get, the correct treatment for your problem when you go into our healthcare system today with a blood supply that has vaccinated blood commingled with unvaccinated blood, when you have doctors who have resigned due to COVID mandates, and most doctors have not resigned and have a gun to their head for a paycheck, is close to zero. Is close to zero that you would get the correct diagnosis and the correct recommendation from your doctor. And your nurse, she's going to say, well, this is what we do. We go with the flow. That's the hospital policy. Well, the hospital policy is immoral. So if you're not going to back down from an immoral system where the patient's rights are ignored and he has no rights in the system, you're in a maritime law, martial law, military law, Ron DeSantis indoctrinated law system. Ron DeSantis was indoctrinated in this type of law. Prisoner dilemma game at Guantanamo Bay. Look it up. Check it out. Ron DeSantis got to pretend to be the defense lawyer for these prisoners in the detention facility in Guantanamo Bay, where he pretended to represent their Geneva Convention rights. What a scam that is. I mean, he's not getting people released from the detention facility because he went to Harvard Law School. He's surfing at the beach and dodging sharks down at the CIA shoreline at the Navy facility known as Guantanamo Bay, 45 miles square on a CIA-controlled island known as Cuba, where Jose Menendez came from, where Jose Perdomo, who murdered John Lennon, came from, where Frank Finarini came from. Well, he came from Philadelphia and then was put together with Fidel Castro, I believe in Guatemala, and then, back to Havana, because Fidel Castro is from Havana, and he went to University of Havana, but then he did his guerrilla training in San Salvador, where Enos Mejia, Abigail Folger's grandparents, have a land trust in El Salvador. See what I'm talking about here? They all know each other. Fidel Castro is on the team, just like Timothy Leary. Fidel Castro, the guy who killed John Kennedy, who I think is Frank Finarini. You know him as Sturgis, Frank Sturgis. That's not his real name. That's his CIA name. Anyway, I think he's pals with General Batista, and he's pals with the Jose Menendez family, and he's pals with Fidel Castro, and he's pals with Carlos Marcello, and he's pals with Carlos or Santos Traficante and the five families in New York, and he's from Philadelphia, and he's friends with Jose Perdomo. They all know each other. It's one big, happy, dysfunctional family. Thanks for listening, and hit the like and subscribe. Happy holidays.